Hi guys, today I'm deal about types of poisoning. Okay, last class we are discuss about only poisoning and management and types only, but here types we can elaborate. Okay, so first one is injection swallowed. Okay, so swallowed poison may be corrosive. Corrosive poisons include alkaline and acidic agent. It can cause destruction of the tissue after the mucous membrane. Okay, so mainly it will be that acid will be burned to the mucus layer. So here the destruction will be happen. So this is called the injection. So alkaline acid. So we are normally using for cleaning for washrooms and floors and all. We use in alkaline and acid products. So that's why here explained. So toilet cleaners, bleach and everything here given. Okay. Next is petroleum. Petroleum everyone knows kerosene and drug overdose, food poisoning. So here management check and maintain ABC because the acid and all. If you are closed room, if you are using acid, it will be suddenly that acid will go to mouth and nose. It will be black the airway. So we can check ABC, take ECG, assess the neurological status, and give water or milk to drink dilution strong acid and alkaline phosphine. Okay, so next gastric lavage. Gastric lavage what will give means first we can give for Hipix introduce syrup because that kerosene everything will come out in gastric level. It will be take that particular gastric liquid and send to the lab to see the toxicity level. Then charcoal administration. So charcoal administration for antidote. So here when appropriate sorbitol, sodium sulfate, magnesium citrate, this is under some emergency medicine we can give. Specific antidote, which condition, which is we can give antidote medicines. Okay, so if the antidote is not available means remove the injection material administration to charcoal or diffuse dialysis and hemoperfusion. Hemoperfusion means extra carbon blood we can take and give the some anticoagulant drug to don't clot the blood. We can give anticoagulant using heparin something to purify the blood and to remove the toxin. Then they will inject to the blood. So here involves deacidification of the blood to processing through the extracorporeal circuit and absorbent cartridge containing charcoal resin, after which is clean blood returned to the patient. Okay, so carbon monoxide what will happen, it will be suppressed to O2. Okay, so carbon monoxide poison result to industrial or household incidents or suicide something. It's a carboxy hemoglobin does not transport to O2. So carbon monoxide what will happen, it will be effect for toxic and making circulating to the HP means blood therapy. Then reduce the O2 capacity in the blood, then absorb the carbon monoxide 200 times more than rapidly O2. So signs of carbon monoxide means headache, nausea, breathlessness, collapse, and dizziness and loss of conscious. So here extra palpitation will be happen, then coma and skin blue color, then false reading pulse oximeter because here blue color will happen na. So that's why it will be happen. So management is here to reverse cerebral and myocardial hypoxia because that O2 will be reducing na. So we can give immediately O2 therapy. So O2 therapy, then open doors and windows and loosening the all cloths, initiate for CPR administration 100% of food and prevent chilling, warm patient blanket, keep the patient to quiet as possible, because here cerebral will be collapse no. So patient will get harassment will do. Okay, so some irrelevant talk, then they're not controllable to self, everything will be happen. Okay, so next is skin contamination poisoning. Skin contamination example hemodrugs and all. Hemodrugs what will happen when you are using any drugs to drugs, it will be spilled to the skin means it will be sensitive will be happen. So skin contamination injury from exposure to the chemical or challenging because of large number of possible to agent to reverse the metabolic effects. So severe rate of chemical burn, it determines the mechanism of action and strength and concentration amount to dilution and exposed to the skin to the chemical. So management is prevent skin expose. So once it will happen, wash thoroughly to the water. Note, water should not be applied to the burns from the lay. The white phosphorus because of the potential exposure. So depending, so deepening of the burn. Okay. So all evidence these chemicals should be flushed off the patient before flushing occur. So start with standard burn treatment according to the size and location of wound. Okay. So using antimicrobial treatment, debridement and tetanus and prophylaxis antidote administration. So plastic surgery if you need, we can do. Then whole OP poisoning. See, this is a main. Okay, we can everywhere seeing this OP poisoning, especially in the farmer area. So OP for components is a diverse group of chemicals used for both domestic and industrial settings. Oranophosphate. Okay, so this is what will happen pathology when we giving that OP to intubate to the acetylcholine. Here that neurotransmitter will be enhanced to the choline to acid. Okay, it will be separate to the acid and choline. It will be affect to the central and peripheral nervous system. The OP is inactivate to the phosphorylation. So what will happen next? Inactivated to accumulate the nervous system. It resulting to overstimulation to the muscarine and nicotine. Muscarine means muscles and nicotine means in the brain. Okay, so it will be happen. Then central nervous system also it will be affect to the whole body. It will be affected. So the OP phosphate means what will happen? Injected, inhaled and injected. So it will be repeated to symptomatic onset and severity depend. Okay, so a compound amount route exposed to metabolic detection. So here muscarine and nicotinic and CNS effect will be there. Muscarinic means this is the code. Okay, sludge, salivation, laxation, urination, diarrhea, upset, emesis. Tumples mean diprosis means diarrhea and urination, meiosis, bradycardia, bronchospasm, excessive lacrimation and salivation. Construct people. அதுக்கப்புறம் so meiosis means I search and I show that one, right? For that people's contraction, sorry, okay, you can see that people, right? Then excessive lacrimation means it's a tear, excessive tear, okay. Then nicotinic signs and symptom, muscle fasciculation, cramping, weakness, diaphragmatic failure, and include hypertension, tachycardia. In muscle, bradycardia will happen. In the here, tachycardia will happen. So meiosis means people contraction, but here mitosis means it will be not it will be dilated but not focused in the light. Okay, it's not focused to the light. So pallor, then CNS, anxiety, emotional abilities, restless, confusion, ataxia, tremors, and seizure, and coma. So that ataxia will what happen means you can't stable proper position, so muscle involuntary will be there. Okay, then treatment, airway control to adequate oxygenation, then intubation of patient necessary, respiratory distress due to laryngoscope, bronchoscope and bronchoria seizures. Immediate aggressive use atropine may eliminate to the need intubation. So succinyl choline should be avoided because here what will be happen already that acetylcholine and all inactivated to, so maybe here prolonged paralysis will be there. So medication, what medication means atropine we can give, for antidote and disibum to patient to control. Initial management must to focus to adequate use atropine and oxygenation, because sometimes it will be happen bradycardia, so we can use atropine also, no problem. Then medication, anticholinergic agent. This is compressive antagonist. It's muscarinic cholinergic receptor, both central nervous system. This is for mainly using for muscarinic and nicotine central nervous system. Both it will be maintaining. Okay, so this is does not affect to nicotine effect. Then atropine. Atropine, how much we can give? 1 or 2 mg IV bolus we can give. So here strongly consider doubling subsequent dose. Rapid control the patient to severe respiratory disease. Here adult 1 to 2 mg we can give. In children's means 0.5 mg per kg IV we repeat we can give. Okay. So this is for only today I discuss with types of poisoning only injected. The injected is what will happen like this I can discuss. And for yours I given assignment for mercury poisoning search and to brief the notes in the group. Okay, thank you guys.